I'm joined by Dr. Rajiv Jaydevan, who is the IMA COVID task member, also belongs to Kerala. So he will be able to tell us more about JN.1 that is doing the rounds in Kerala. One case has in fact been detected. So I'm joined by Dr. Rajiv Jaydevan. Thank you for joining with us. And starting with what is really the situation on ground in Kerala? One case of JN.1 has been detected from Trivandrum. So how worrisome is the situation?
We have been tracking the pandemic from before it entered India in 2020. And over the past couple of months, we have seen an uptick in respiratory illnesses, which is cough, cold, breathing difficulty kind of illness. But on testing, especially in the early part of November or in October, we really did not see many COVID patients at all, apart from one or two. But towards the end of November, cases started coming in. In other words, with the same symptomatology, we were finding they were belonging to COVID rather than due to influenza. So, in other words, people with these symptoms are increasingly found to be due to COVID. That's the way we see it on the ground. Most individuals are not requiring hospital care. They could be without symptoms. For instance, somebody who enters a transplant facility gets tested for safety purposes, and they may turn out to be positive and discover that they've had no symptoms. They've had no symptoms. Likewise, the younger and healthier people are having what is typically a few days of severe body pain, tiredness, unable to go to work, a bit of headache, runny nose, sore throat. Not so much of cough, not so much of pneumonia. We're not really seeing pneumonia now, unlike during the Delta period in 2021, that was carnage. Now, over the last few days, the number of cases have gone up. But if you look at a situation on the ground in tertiary centers, people are coming in with fever and other symptoms like before. But the number of COVID patients is not overwhelming. But that being said, let me say this. The reported numbers always depend on testing. And specific forms of testing like RT-PCR and government facilities get reported. Antigen tests done at home are not tested, are not reported. Most people are not keen to test anymore. Doctors are not keen to test anymore because it may not make a difference in management and it only adds to the expense. So all of these things are factored.
No. Are you saying that this variant is evading the RT-PCR test? Can this be detected with the RT-PCR test itself?
No. In fact, RT-PCR test will pick up the variant. It is not evading the RT-PCR. But the point is that if you look at people who are coming in with symptoms of COVID or symptoms like COVID or respiratory illness, we were not seeing COVID 2 months ago, but we are seeing COVID now. That's the point. The second point, as you asked about evasion, yes, JN.1 is profoundly immune evasive, which basically means that it will escape, it will jump over the fence. If your fence is what you built with your vaccination and having survived natural infection, 1 or 2 or even 3 bouts of COVID, this variant leaps over it like it never existed. So that is really what we're seeing. So just because you've had vaccination or boosting or whether you've been past infected, please don't think that it will not come to you. It could come to you quite easily. And how does it come to you? It comes to you through social gatherings, indoor crowded settings, when we mingle with people who have fever and symptoms such as this. Yes, that is typically how it spreads. And people in the old age group must be a little careful because they may end up in the hospital because they have conditions that may destabilize.
All right. What do we know about the symptoms of JN.1 and what are the precautions that one can take when it comes to JN.1? Because we are seeing that this is the same variant that is doing the rounds in US and Europe.
Yes, all around the world, JN.1 is the fastest growing variant, which means it was able to outnumber and outcompete its other cousins, if you will. Say XBB was dominating India and the rest of the world until sometime in August. And until then, XBB started weakening, and then JN.1 is increasing now. In terms of symptoms, it can range from no symptoms. For instance, as I mentioned, somebody who walks into a transplant facility gets tested for COVID just for safety reasons. They may discover that they're COVID positive without really having symptoms. Secondly, as I mentioned, younger and healthier people tend to have flu-like symptoms, which is not cold, but severe body ache, stopping them from going to work for at least a few days. And the third category are people with other disease conditions who that tend to worsen, requiring some hospital care And the fourth category really is people who desaturate, which basically means the oxygen levels drop. They end up in the ICU requiring oxygen and so on. But that's a tiny minority so far. So we have to wait and see how the season pans out. It's early days now. December is coming. We are halfway through December. Holiday season is kicking in. A lot of people are visiting family from abroad and from other parts of the country. And this is the season where people travel all around the world.
So in the statement, the Health Ministry and the Kerala Health Department basically said that the 70-year-old woman from Trivandrum who has been detected with this variant has in fact recovered since then. So can we say that this is a mild variant and we can't, there is no adverse effect to this variant?
Yeah, that's been the story of COVID from the beginning, in fact. If you take even the most lethal variants like Delta or the first version, when we had no immunity, the number of people who died was relatively small compared to the number of people infected. In other words, a massive number of people were infected, and that is really what translated to a large number of deaths. So point I'm making is, we take 100 people who get COVID, only one or two will have very, very severe disease. So likewise, as of now, when Omicron has, since Omicron has come late 2021, JN.1 also is a version of Omicron. So it's a different version of Omicron, vastly different version. The symptoms are pretty much the same. The 99 out of 100 really did not really require hospital care. And a small percentage actually requires it. But the problem with this enormous numbers of people are infected. Yes, that translates to larger numbers trickling into hospital. And that's the point here about being a little careful. So if you're having a fever, stay home, don't mingle. And unless absolutely necessary, don't go to hospital. Especially social visits to hospital are a part of culture in India. No, hospitals are not places for social visits. You could make your social visit by a phone call or a video call. Please don't go to hospitals just for social visits. Go only if absolutely necessary. And if you go, wear a mask.
My one last question, that is, we are seeing for past 2-3 years, we are seeing multiple variants, sub-variants of COVID-19. Will this keep continuing? And are our vaccines, stable enough to fight these variants? Do you think there is a need for a booster dose for the population, like a fourth or third booster dose?
I understand. Now, COVID is yet another cyclical disease that has arrived on the planet. There are so many other viral infections that come and go in waves. For example, influenza and para-influenza. They're all cyclical. In other words, there's high tide and there's low tide. COVID gave India a low tide of around 7 months. So we had a good 7 months where we could mingle freely, and really it did not create a burden. For the next couple of months, we can expect a surge for COVID. You asked about vaccination. Yes, vaccination had a great role, especially in the early part of the pandemic when none of us had any immune memory to this new virus. And getting infected to get memory was not a smart idea, because the first version created a lot of deaths in the process of achieving that. So vaccination gave us a safer option of getting an immune memory, if you will, and the immune memory that we got is long-lasting, which means that even if our antibody levels drop, if we get an infection, this memory will kick in and it will produce an essential immune response, which will keep us safe. Whether a booster dose is necessary, that's a long question to answer. But to put it very briefly, the vaccines that are available or were used in India were based on the first version, and the version that's circulating now is vastly different. And that being said, even updated vaccines that the US made, the XBB.1.5 monovalent booster, this new variant is even evading that. We are getting reports trickling in about this variant infecting people who've just had a booster dose. So boosters may not necessarily stop the infection, but for the extremely vulnerable people, it may improve a level of protection. That's what the Americans believe. From India's perspective, I believe we are well placed in terms of past vaccination. We are a very, very well vaccinated nation. On top of that, we have people who have survived natural infection also have antibodies and immune memory. So chances are that we can continue with whatever we are doing right now in terms of let's say non-pharmaceutical interventions, which basically means mask, social distancing, cough etiquette, hand washing, avoiding crowded gatherings, improving ventilation of indoor settings, and so on.
All right. Thank you. Thank you for answering all the questions, Dr. Rajeev J. Devan. Thank you.
My pleasure.